Hey everybody, this is Alec with Home and Rehab, and today I want to just answer a quick question that I've gotten a couple times this week because I've had several patients with vertigo come in. And so what I get a whole lot is, okay, doctor said that I can just fix vertigo with physical therapy. Is that right? The answer is sometimes. Of course, just like with everything else, this is more complicated than just a simple, oh, I feel vertigo, this quick thing is going to fix it. There's a very specific kind of vertigo, which is called positional vertigo. That positional vertigo is usually caused by a very certain set of physical structures that actually are something that's very easy for your body to overcome. And some people actually accidentally fix themselves. So, positional vertigo is a very, very specific kind of positional trigger for room spinning dizziness. So what that means is the majority of people will get their symptoms when rolling over in bed. And then for a period of a couple seconds to a couple minutes, will experience the sensation of the entire room spinning around them. The reason that happens is not so crazy. Inside our inner ear, you guys have probably heard about that if you've heard about balance issues, is a small little organ that fits about on the size of the head of a pin. It has 3 bony canals, each of which is filled with fluid, and that fluid rolls over hair cells. Not so different from the hair on our head. So, as you guys notice, when you brush your hair, you're able to feel which direction your hand is moving over it because of how the hair is being pulled. Your body normally relies on that very same sensation coming from this inner ear structure. However, when I turn my head in various directions, canals aligned with that direction are going to experience momentum changes, and any fluid inside that canal is going to move with it. Our body can then detect how that hair cell is being perturbed by the fluid flowing through the canals, and we can tell where we are in space. It's not quite as accurate as our visual view of the horizon or how we feel the floor beneath our feet, our proprioception and our visual sensation, but it does give us a fairly good idea of what is up, what is down, and when we are moving, even when it is dark and we can't feel the floor very well, which is kind of what this is for. It's our emergency backup system. In order to help our body correct and understand the environment around us, it actually has a direct relationship with our eyes. So there's a reflex loop built in, so if the body detects us moving up at an angle, left or right, or up or down, this organ can tell our eyes about how far we move so that our eyes can stay tracked on the same target. So actually, if you see right now, I'm staring straight at the camera, and my eyes are staying right in that same position even though my head is moving. Because I have attuned this sense to be able to track an object. It's something very common in most sports and athletes. We really work on this skill, sometimes even on accident. The nice news is it's trainable, which is great. It means something that you can get better with activity. However, those bony canals sit right next to a separate organ. This organ is built to essentially sense up and down motions. In order to detect that, essentially what we have is we still have hair cells inside essentially a fluid-filled sac. However, on top of that sac are some calcium crystals. They are designed to provide a little bit of weight so that as our body moves up and down, it gives us the inertia we need to squish down that fluid-filled sac and tell the hair cells that you are indeed being pressed up or down, depending on how it feels. Unfortunately, like every structure in our body, those can flake off. And because of the opening that exists within each of the canals that is designed for our momentum-based changes in angular momentum, sometimes those crystals can actually make their way into some of the canals. What this means is when we are in positions that would allow these canals to be in a gravity-dependent position, those crystals can start to fall and cascade down the semicircle. What that means is as they fall, they're going to start triggering those hair cells and trigger our eyes to correct themselves, even though we're not physically moving. So what our eyes actually start to do is they try to adjust. So the semicircles that are in the posterior region try to adjust for an angular change like this. So what you'll actually see is the eyes are going to kind of twist up in order to accommodate for a change that they think is happening because of this organ. Now the good news is if it got into that opening, we can get it back out. So what you'll most commonly see when we have any sort of canalithiasis, which means something is stuck in this canal that is causing the hair cells to be triggered because of gravity, people, when laid into certain positions that trigger specific canals, are going to have those rocks, with otoliths is one of the words for them, or calcium crystals, depending on what you're reading. You'll hear crystals used very often. It's nothing magic, it's just specifically how this structure looks under a microscope. It looks crystalline. When they get inside our bony canal, If we are in a gravity-dependent position, like laying down with our head slightly cocked back, or if we're laying directly to the left or right, what we're going to see is eyes trying to make quick adjustments for a couple of seconds until that thing stops cascading. When that happens, if we see that direct correlation of movement with a gravity-dependent position, now we know that the position is causing the vertigo. Vertigo literally means room spinning sensation. So if we're getting room spinning because of the eye movement, because of position, it is now positional vertigo. And we can then use almost a reverse of the maneuver that we use to test to try and get those back out of the opening and back into the central area, which we do believe in most people seems to be reabsorbed back into the bloodstream, and so it doesn't cause most problems in the future. Great news, right? Now, there are other things that can cause this dizziness. All of these messages are relayed from the organ into the brain through the vestibular nerve. Things that happen to that nerve can also trigger this reflex, something like an autoimmune disorder known as Meniere's disease, or certain inner ear infections. Even sinus pressure can start to put some pressure on that inner ear. We'll tend to see some slightly different issues. Most of the time it's going to be more when sinus pressure is at its worst that we get our dizziness if we get something like an allergy-related dizziness. If it's Meniere's disease, it seems to come out of nowhere and leave as soon as it came. Those different types of things give us a little bit of an idea of, all right, what might be causing your vertigo? The good news is, in all of these cases, there's usually something we can do to adapt the body, whether it's through medication, physical therapy, and sometimes even some different physical measures that can be taken by physicians. But it's important to identify specifically what's going on. So just because we have dizziness does not necessarily mean it's vertigo. We are looking for specifically room spinning sensations. Just because it's vertigo does not necessarily mean that it is positional vertigo. We go through a series of tests in here to try to figure out what it is. However, positional vertigo tends to be one of the most common types, and therefore there are good odds if you do get vertigo when lying down, there is something that can be done about it that usually resolves it relatively quickly. Now, that said, if you've had vertigo for a long time, your brain can actually start to adapt. And so it's important that if you've had vertigo chronically, meaning that you've had these issues for a couple of weeks to a couple of months, some people even a couple of years or longer, because their doctors were not familiar with the things that were able to resolve it, what you will sometimes see happen is their brain will create some neurological adaptations to try and shut down listening to the inner ear, which means that they're not going to have as good a balance even once the vertigo is gone. That is something that you can retrain and overcome, but it's important to know about so that if the dizziness is gone, you can still understand why you might have what's called disequilibrium, which means the inability to balance appropriately. So, if you are having vertigo or vertiginous symptoms, it's important to talk to your doctor first, because there are other things, like we mentioned, that are more neurological in base, to make sure that we rule out before we first rule in physical therapy. However, if we've talked to doctors and we've had the appropriate scans and tests done to make sure that this truly is an inner ear issue, sometimes they'll require referral to an ENT depending on your personal doctor's abilities in that realm. But once you do get referred to a physical therapist, there's usually some very good odds that will be able to help you out. Now, not all doctors are comfortable with this. This is usually something that's taught in extra continuing education seminars. It's not something that's taught as part of standard medical school for most people, or even standard physical therapy school for most physical therapists. Most of us have to go through additional training to do this. So if your doctor or physical therapist is not comfortable with this, there are a couple different resources you can look into to show you somebody who is. ENTs, or ear, nose, throat specialists, are very common to see that. We have a couple. I know Celebration Hospital happens to have a specialist in that region who specifically works with vertigo quite often. And of course, there are people like myself who have gone to the extra studies to make sure we do understand this. And you can find that through the Vestibular Rehab website. It's part of the neuro section of physical therapy. They have their own website with a map of different vestibular strength providers throughout the United States. So if you have questions on this and you're not quite sure who to talk to, resources like your local ENT or the neuro section of the American Physical Therapy Association can often help you out in finding who you can talk to. There's also a separate website that includes people who've registered with it called VEDA, V-E-D-A. VEDA has a resource throughout the United States that has a large amount of us who are vestibular specialists listed on it. They don't have everyone because it is not part of the American Medical Association or the American Physical Therapy Association. It's its own separate branch. However, if it is something you're looking for, they often will have the resources you need to get started. Thank you guys very much for tuning in. If you have further questions about things like this, please let me know. This is one of my areas of passion, clearly. It's something I enjoy working with. So if you ever need help with it, please let us know. Have a great one, everybody.